Hi, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist podcast show, where you ask questions about getting into dental school, surviving dental school, getting into residency, surviving residency, even coming to America to become a licensed dentist and practice dentistry here. We get a lot of inquiries about those topics, and we're going to be talking about that and more. Be sure to subscribe to my YouTube channel, Dr. Darwin Speaks, and turn on the notifications, as I will be posting videos on a weekly basis, sometimes 3 or 4 times a week. So I don't want you guys to miss those videos that have been helping a lot of people across the country and also across the planet as well. Today, we're going to be continuing in our series, Careers in Dentistry. But this career in dentistry is a little bit of a twist. We're going to be talking to a couple of new dentists that are on this podcast wave here, that have been doing some amazing things these last, I don't even know, a couple of months, less than a year. And right. they are grounded and grounded and have a good foundation in it, and they're just going full throttle. So welcome to the show, Dr. Priscilla and Dr. Kyle of the Misdiagnosed podcast. How you guys doing?
Good. Thanks for having us. I heard you your introduction. It made me nervous all over again. Like I'm applying to dental school again.
Right, bringing back those memories, right?
Exactly.
Yep. Oh my goodness, please. That's a whole nother discussion right there.
Oh, I know.
But discuss and share with us a little bit about yourselves.
Okay. Well, as he said, my name is Dr. Priscilla Clinton. I am currently practicing with Aspen Dental in Michigan City, Indiana. But I live in Chicago, so I do a little bit of a commute to work. Yeah. I went to undergrad at Clark Atlanta University, so shout out to my HBCUs. And I went to Indiana University in Indianapolis, Indiana.
And I'm Dr. Kyle Ratliff. I'm from New Albany, Indiana. I did my undergrad at Marian University, which is a small Catholic university, transitioned into dental school at IU, graduated in 2016. After that, I did an AEGD in Arizona, and now I finished my first year of working for Aspen Dental in Fort Wayne, Indiana, which I'm currently located.
Wow, so both of you in Indiana, huh?
Yeah.
Okay.
Yes.
Okay, only connection I have to Indiana is I got some cousins out there that were from Kokomo, Indiana. And I don't even know where that is.
Oh, they out.
Honestly, I don't know where that is either.
Yeah, so that's my only connection, and a couple of faculty members that are out there at Indiana at the dental school. So yeah, that's about it. So you guys are working, but you also been working on this podcast. So
yes.
Tell us a little bit about this this podcast, the title. Let's just start off with that first.
Well, the title, Misdiagnosed, it came from a group chat. I feel like most of us are in group chats. And so you're always, talking to your friends, sending memes and stuff like that. And so it was just one day where all of us kind of had like a crazy day at the office, and everybody sending stories about their patients, talking about things that they would have done differently. And me and Kyle are like, yeah, that's true. I feel the same way. And so yep. Kyle texted me outside of the group chat, and he's like, we should do a podcast about this. And I was like, you know what? I agree. I think that not only like new young dentists can identify with this, but young professionals in general. We're still learning, still getting our bearings in our different fields. And as far as being misdiagnosed, I'll let Kyle expound upon that a little bit.
Yeah.
But it's just like, it's not just for dentists. It's for all professions across the board.
So just to add on to what Priscilla was saying, everyone has been misdiagnosed at one point in time. What we say misdiagnosis is someone's wrongful perception of who you are. It could be your character. It could be your job description. It really doesn't matter. And our kind of subtitle is what you see isn't always what you get, meaning that someone can judge you based upon if you're a minority or if you're a woman in dentistry, a man doing dentistry. It doesn't really matter, but it's just someone's misdiagnosis of who you are and how to combat that.
Oh, how to combat it too.
Yeah.
Wow. Okay.
Yeah.
So tell us a little bit about some of the podcasts that you guys have been doing, some of the titles. I'm on your website now. I see some food and beignet, baguette. I see that one. Y'all making me hungry on that one. and about why I know why the cage bird sings. A little Maya Angelou's thing there. So
Yes.
It don't sound like dentistry to me, but I'm sure there's a dental twist to it.
Yeah.
Exactly. So what we do is we try to not only incorporate dentistry. So we'll find articles, in the ADA newsletter that they send out, things about dentists in the news, whether it's good or whether it's a little racy. We take into account pop culture, things that we see on social media, because as millennial professionals, we're finding that we're all interested into this, social media world. A lot of us display our work on there. People vent on social media quite often.
All the time.
It's just, there's so many different avenues to it. So we try to take into account, those things that millennials enjoy. And it's not just for us, but we found that the age range who typically listens to our podcast are between 25 and 35 years of age. And so we talk about politics sometimes, which is very crazy right now. And it's such a hot topic. So we incorporate that. We incorporate patient stories, like we said, things from the ADA, things about, in the medical profession, what's going on in there. And so the Cage Bird Sings actually talked about Colin Kaepernick and some of the things going on with the American flag and the national anthem and how different sides felt about that. We talked about the beignets, as you saw. Myself, Kyle, and some of our friends and family went to Europe last month, I believe, and it was an enjoyable trip, but we definitely had to give our views and our opinions about being in another country. But yeah, Kyle, did you want to talk about any other topics that we've discussed?
Yeah, we've a range of different topics that we discussed. We've talked about the stigma. The big question is, should I do an AEGD or GPR? We discussed that because I did an AEGD and Priscilla did a GPR. So we both have different experiences and opinions on that for new dentists as well that we elaborate on. And from even there to, we even always talk about different being misdiagnosed in our practices. So I'm a new dentist. I practice in a corporate dentistry, and that can be different in itself. When you're in corporate, they want you to produce. So ethical standpoints come from that. Am I going to produce and do things I shouldn't do, or should I be ethical and do what I need to do? So that's some things that we talk about and discuss in our podcast as well.
Yeah, a big topic. Yeah, it's like mental health. We've covered mental health, especially among dentists, because that's kind of big, a big broad spectrum there.
Yeah, absolutely. So with you guys working pretty much full time and hustling, how do you guys prepare and produce for the show?
Well, so we both work in Indiana, but again, Priscilla lives in Chicago. So it's more of using social media or FaceTime to get our material, and then we discuss it via FaceTime or calls. And then we actually have to set up a date for us to either she comes to Indianapolis or I'll come to Chicago, and we'll review our topics and get our outline together, and then we'll start our production and recording.
Okay. Now, is this something you guys kind of learned about and kind of morphed into, like on the podcast training type of thing, or did you have some previous experience with it?
Yeah, we have no experience. Honestly, when we say we are true dental nerds, I will say that. I will claim it. We are kind of dental nerds. So when it comes to IT and any form of technology, we had no idea. We were asking people that we knew who are engineers or into computer science. We were like, well, what do we do? How do we, get this to work together? And so some of our friends were super helpful, but a lot of it came from the internet, honestly. And we say the internet always wins. Yeah. Google was our friend. We learned so much from Google, and we're still learning, honestly. We have a ways to go, but I'm super thankful for the articles that have been put up and, and all the little things that have kind of helped us out on the internet.
Yeah. With the RSS feed, we did go to Midwinter and in Chicago, and we met a production company to kind of help us with putting our podcast on iTunes and Spotify. And they've been really helpful in that because, again, we didn't really know what we were doing. So we did reach out to others to help us get to where we are now.
Yeah, I'm going to give you guys a little thing that I learned just recently. Anchor. If you haven't used or heard about Anchor, ANCHOR, it's a platform that allows you to record audio or drop audio into it, download, and Anchor will distribute out to iTunes, Spotify, Castbox,
Oh,
Stitcher.
wow.
So if you check out Anchor, I can get you some more information about it, but you can go right onto their website. Very easy to use. You can also do an introduction. They have some transitional songs, intro music that you can use as an intro and as an extra outro that makes your podcast, I mean, just really, really nice. So that would be something else for you guys to take a look at in the future.
Okay, thank you for that.
Yeah.
We will.
Absolutely. You know, that's part of the process when you're learning and you're sharing information.
Right.
So again, how would you guys say you think your show contributes to the dental profession?
I personally think it gives a different perspective. Again, we're young minority dentists, young professionals. And, you know, there's a kind of stigma in dentistry when you think about a dentist. A lot of times people just associate it with being an older white male. And so dominated field. So we give a totally different perspective because a lot of times I walk into a dental op and they see me and the most common response I get, ooh, you the size of a linebacker, you know? So that's a different, you know, I guess, thing for them to see. But then I'm like, I'm your dentist, so please open up your mouth. So that's one thing for me. What about you, Priscilla?
Yeah, I think we give like a humor to it. We know like in dentistry, a lot of us are perfectionists. We want to do things right. We want our procedure to go well, go off without a hitch. And that's not always true. It doesn't always happen. So a lot of things that we talk about is one, like if you mess up, how do we fix it? But also just find the humor in that, learning to relate to your patients on a different level, and just trying not to take yourself and trying not to take our profession so seriously. Because at some point we may mess up and that's okay. We're human. But we'll figure out how to fix it, but we just can't be so hard on ourselves.
Right.
That's right. That's right. That's great. Well, you're right. The different perspective is is needed. You know, there's been a movement in the last several years about diversity in dentistry and how important that is, not only in the student body, but also faculty and faculty that are preclinical, but also in the clinics as well. And it's so important because, especially now with a lot of patients not necessarily wanting to go to the doctor, whether they be physicians or to the dentist, but you know, there's some studies that are out there that have demonstrated that patients tend to follow the instructions and see their physicians or dentists more when they look like them.
Yeah.
Right. So having this perspective that you guys are delivering and having a voice within dentistry is so key and so important. So I salute you and applaud you guys for doing.
Thank you.
Doing it. It's needed. It's needed. So what kind of projects are you guys working on right now? I mean, or what projects are you planning on working on in the future? If you can share with it. I don't know if you've got some hush projects.
Secret.
Well, we have our website that's currently being built. So within the next couple of weeks, you guys can check out alwaysmisdiagnosed.com. It'll definitely include the newest episodes of our podcast, photos of us, and kind of our schedule as far as where we're going. Because we do want to continue to partner with SNDA chapter and ASDA chapter doing lunch and learns and kind of talking with the dental students. We are also working on doing a documentary because we want Misdiagnosed to not only include dental professionals, like we said, we want to go over all scopes of different professions and kind of hear how people are being misdiagnosed, how it makes them feel, how it's impacting their lives and even their communities. And then we're working with a couple of startup companies. We can't say anything right now, but once everything is all sealed and put together, we will definitely let you guys know within the next month. So yeah.
That'll be great. Yeah, I definitely want to get you guys back on when you guys are ready to launch that, whatever you're working on with the startup. So that'll be good. So we can get some promotion and some PR out about.
Absolutely.
Yeah, thank you.
That'll be great. All right. So knowing what this is the part of the interview we kind of continue to reach out and give advice and give some tidbits and some pearls based on your experience to this day. So knowing what you know now, what would you guys do differently, whether it be career-wise, training-wise, or even in podcasting that you guys are still learning right now? Knowing what you know now, what would you do differently career-wise and or with podcasting?
I would say because of the student loan crisis, I would have went into the military, whether it was the Navy, Army. That's definitely a great way to help repay some of your loans with years of service. I'm fortunate. I do work for a company that does help with loan repayment, but the amount that I owe is going to take a long time to pay back.
Do you mind sharing that amount? Is it above the average of 287?
Correct. It's way above 287. I wish mine was 287.
Where'd you go to dental school?
I'm in state. I went to IU, Indiana University, and I was born in Indiana, so I did get in-state tuition. But by the time undergrad also adds onto that, the amount surpasses that $287,000.
So your loan debt amount is both undergrad, the one that you're talking
Correct.
about?
Yes.
Okay. But for dental, just dental by itself.
It's, around that 300,000 mark.
Yeah. How about you, Dr. Priscilla?
You know, I'm going to have to agree with Kyle. I had out-of-state tuition because I'm from Illinois, and I didn't really have many loans in undergrad. I did have a pretty big scholarship that kind of covered all 4 years, so I didn't have much debt coming from undergrad, but mine is about, we'll say, around the 400 mark. So I definitely, one thing I think I would have done is because during residency, we're kind of on that period where we don't have to repay loans. I think I would have started moonlighting in residency and using that towards my student loans, or either doing, National Health Service Corps or something like that. I'm not big on the military. I don't think I'd fit well in the military, but some other way of repaying student loans, absolutely. Yeah.
Going to an underserved community would be a great option.
Yep. FQHCs, there are a lot of programs, even through HRSA, where they are looking for general dentists to go to those underserved areas, and they have grants for the institutions for dentists that are there a minimum of 2 years, and in an area where people need us to be there, and they'll give, I think in some cases, $20,000-$25,000 a year towards that. And it doesn't pay off of all of it, but
it helps.
It helps. It helps. And the fact that you're aligned with a couple of offices that have that opportunity for some loan repayment, whether it's through a program or even if it's through ownership. I know Aspen is very big on developing new dentists for ownership positions within the first 3 to 5 years. So that's good as well. So good. Do differently would be loans maybe going into the military, maybe doing some moonlighting, something similar to that. Gotcha. Good. So two tips of advice for our new dentists, whether they're pre-dental, whether they're current dental students, whether they are residents, or even those like yourself that have been out less than 5 to 10 years. Give us two points of tips of advice.
Mine would be confidence. Honestly, whether you're a pre-dent, pre-med, whether you're a new dentist, you're going to need that. I've noticed, I'm going into my second year now, and in the first year, I was a little nervous just because I always got, oh, you look really young. How long have you been doing this? And that would kind of shake me up a little bit within the first year. But, I started kind of joking with them and going with it and kind of just using it to my advantage, and that confidence has started to pay off because they can sniff out, people can sniff out when you're nervous or when you seem like you don't, know what's going on if you're not super confident in what you're doing. So even during the interview processes, when you're working with patients, when you're, interviewing for residencies, whatever it is, be confident. You're very competent. You know what you're doing. You didn't get here by chance. You're here for a reason. So go with it.
Yeah, Absolutely.
And I would say the other tip will be, a lot of times as professionals, we don't want to seek help, but I found it's been very helpful, whether I was a pre-dent or even now as a dentist, to seek out help. Sometimes we're only limited to our own knowledge. So if you're a pre-dent, definitely get connected to your pre-dental society. If you're a new dentist, there are new dentist conference, for example, sponsored through the NDA or the ADA, as well as getting connected in your local dental society. And those, they will help you along the way and give you tips, and you can glean from older dentists and even some of your peers and colleagues. So,
yeah, absolutely. Absolutely. And that was one of the reasons why I created this podcast and, you know, my platform, to try to help as many new dentists as possible, because it's a lot of stuff that, you know, as new dentists, we don't know coming out of it.
Absolutely.
A lot more than most people think. And it's good to have a platform or have some people or be connected with a network or a group association that has some of your interests in mind to kind of help you through transitional times. You know, the first 5 years is so very critical for you all as new dentists. So seeking help is good, and also being confident. So that's great. That's great. So, you know, we're going to wrap it up here. How can people contact you if, you know, they want to hear more, or they want to find out where the podcast is located? I know you mentioned your website is coming, but if they want to contact you all individually about residencies, about your time in dental school, about some of these new projects that you guys and collaborations that you guys are putting together, what's the best way for people to contact you guys?
You know, we always tell people you can slide in our DMs on Instagram. We are available at Always Misdiagnosed on Instagram, Facebook, and Twitter. You can send us your questions or any comments or concerns that you have by alwaysmisdiagnosed@gmail.com. And then, of course, be ready and check out our website when it's available in a couple of weeks.
And it's fun. It's fun. Also, some of the questions that we do get, we answer them on the podcast. So a lot of other people can, again, glean from your question.
Yep.
So.
Yep, that's the best way to do it. That's the best way to do it. Hey, guys, thank you so very much for your time this morning. And keep up the good work. Salute. Keep being able to spread your word and give that perspective that people that look like us or even have issues like us are looking for, to help them transition and become a better person, but also a better professional. So I appreciate you guys. Thanks so much for your time today.
Absolutely. Thank you so much for having us on the show.
You're welcome. You're welcome. If you guys are listening, if you guys want to be on the show as well, you can always send me your questions. You can send them to me right here at newdentistcoach@gmail.com. We'll get your questions on the show and be able to share your question and the answers to you. Also, check out this next video that's coming up, I think right here. Check out that next video, okay? All right, Dr. Priscilla, Dr. Kyle, thanks so much. We'll see you soon, and we'll talk to you soon as well.
All right, thank you.
All right, bye-bye.